What's up? Um, Another live stream, public service, whatever you want to call it. I'm here to teach you guys how to perform your own soft tissue mobilization without being too overly technical. It's about how to apply technique to a specific body part without having to memorize any of the medical jargon, the anatomy, if you will. So, when we say connective tissue, we're referring to anything that is not bone, blood vessel, nerve, fat, or gland. So basically, you're talking about skin, ligaments, tendons, muscles for sure, and the interstitial stuff we refer to as fascia. I've spoken about fascia in the past extensively, so everything's made out of fascia. Okay, so let's define what these areas are because you have muscle bellies. That's a muscle belly. And then you have seams. That's a seam. All right. I know it looks gross, but that's supposed to be loose. Here's another seam. SEAM, where two structures come together. All right. Those are your points for gliding. Areas of contact where the tissue glides on top of each other. So this particular seam is the biceps sitting on the humerus, okay? And we have that also in the neck. So where you have seams, you're gonna have connective tissue growing in there just like cotton candy. So the integument, the skin, is that outer layer that protects us. But what holds it underneath? What holds the skin to the structure underneath? Well, if you lift that up, or literally if you can lift the skin over, flip it over, you'll see that, again, there's that connective tissue that looks like cotton candies called fascia. No surprise there. And then we have around the joints. I'm referring to that. In the wrist and the elbow, also in the knee and the ankle. They refer to this connective tissue that wraps around as the retinaculum, okay? Well, let's just call it a wrapper, okay? Wrapping. So if you bring two bones together like this, how does it stay together? You have connective tissue holding it together. In the fingers, we call it the capsule, all right? In any case, they're connective tissue. And then you have, all right, so we have the seams, all right? The seam, we have the capsule, we have the retinaculum, we have the muscle belly, all right. What else am I missing here? That's whatever else comes to mind in a little bit. I'll let you guys know. Anyway, how to loosen up the connective tissue so that you can have mobility in your joints. Okay, for those of you who can't open and close your fingers fully, it's because not because of your bones, it's because your tissues have tightened up, all right? So whatever the issue may be, if you've lost mobility, don't blame your bones, okay? So for the fingers, we have a connective tissue that covers that. It's called your capsule. So all you do is just with friction, you're going to rub the skin. All right, let's use this knuckle right here. We're gonna rub that. And think of it as cling wrap. You're trying to loosen it up. So two things are happening here. There's a mechanical change where the tissue loosens, and there's also the obvious thing, which is friction. Heat. You're creating heat, which helps to loosen up the collagen. And you do this over and over. Pretty soon the capsule starts to loosen up, and now you're gonna have more movement in your joint. All right, pretty cool stuff. So that's how I maintain my fingers and my hands over the years. I've been doing physical therapy now for 28 years, and I got no problems with my hands. In fact, I even broke a bone there back in 1998. Anyway, my point here is you do good maintenance on your body parts, they'll last you a long time. So loosen up the joints by doing this. For the wrist, you loosen up we spoke about the retinaculum, all right? So imagine doing the same approach to a larger joint, such as your knee. The elbows, same way, all right? How do you know if what you're touching is correct, or if you have to treat that body part? Well, the skin tissue, first of all, needs to move. If it's not moving, and matter of fact, it's not moving, it's also painful, then that means it's restricted. So I can tell you from experiences that if the tissue doesn't move, the bone underneath the joint will not move. So that's how you lose motion. Commonly misconceived as arthritis. It's so easy to throw the word arthritis around, but what is it really? All right. So that's how you loosen up the wrappings. All right. That's for the wrapping. The seams. So we have seams where two structures come together like this, and that's how we move. All right. The action of two structures sliding on top of each other. There you go. All right. So you want to make sure that the seam is free of, I call it gunk. It's really fascia. Again, there's that word again. So if you stick your fingers within the seam, what you're doing in effect is you're stretching and tearing that delicate connective tissue, which we refer to as fascia. It looks like cotton candy, and it should have that consistency of cotton candy. All right, so I like to show my patients this little trick here, and I tell them, look, it's supposed to be pain-free. So we have that in the neck. All right, so for you guys who have stiff necks, you can do that here. You can literally just lift the muscle. Here's another one. All right, there are seams there, and you want to make sure that the seams are free of adhesions so that they can slide. This is actually how we move, right? So now it's not muscle. It's, well, think of your peanut butter sandwich. That's the peanut butter, and that's the bread. Okay, now we have the muscle bellies. So if you have a muscle belly, I call it raking. It's like you dig your rake in there, and you pull or you push. In this case, we're going to use that's a dull rake, isn't it? So you push. Or you pull, doesn't matter. It's like stretching dough. Think of pizza dough. You're stretching the pizza dough and you're trying to create length. So you can do that with muscles that you can stretch, like for the chest, you can open that up. You can use your fingers to stretch the tissue. I mean, the limitation here obviously is whatever you can reach, I suppose you can say. I'm not going to be able to work on my back very effectively as I would my forearm or my thigh or my calf, because I have better, I can maneuver my hands better around those structures. I really can't. It's not worth working on your own neck, because by the time you finish loosening up your neck, you've already cramped up somewhere else. So why is it so important to do these manual soft tissue techniques to yourself? Well, for one thing, massages can be rather expensive. I know that for a fact because I get massages every 4 to 6 weeks. We used this example last time of losing motion. So if the wrist is loose, it's because the tissue allows it to move, right? If I shorten the tissue, see my fingers start to curl down like this? I've lost motion. That joint is compressed. So this is what happens to us when we become sedentary, or let's just not use the word sedentary, a lot less active. So you lose motion, you compress the joint, you create symptoms in the joint, and our surgeons love to give you injections there when really the problem is this. You loosen that up, you're back to, this is where we want to be. We want to have movement. So in review, wrappings, the skin, the muscle bellies, and the seams, those are all tissue. So for the wrapping, you rub and you stretch, usually in a spiraling technique like this. Friction around the smaller joints, right? For the seams, you just stick your fingers in there. There's a seam right behind the pectoral muscle, right behind the chest muscle. You should be able to lift that up and be able to literally lift the pec off the chest wall, the ribs. Seams in the neck. And then if you're not sticking your fingers in the seam or you're rubbing, this reminds me of rubbing dry paint off your knuckles. You're actually stretching the pizza dough, or I really want to use the word raking. But that seems to be too aggressive of a word. We want to use something that's gentle because this stuff is very painful to begin with. Working on tight tissue is painful, folks. It's not pleasant. So, there. You want to be deliberate with your approach, and you will feel the tissue stretch. I prefer to use something like that. It's cocoa butter. Just enough to get a little glide on your skin. You don't want to do this stuff dry because you will tear your skin up. And you use too much lotion, you just slide all over the place. It's pointless. So once you've loosened everything up, then now it's okay to stretch. Matter of fact, I don't even tell my patients to stretch. I tell them just move. You're loose. All right. And, every body part needs a sort of a maintenance program. In the same way you brush your teeth every day so they don't rot, in the same way you eat every day so you don't die, you should have a hand maintenance program. You should have an elbow maintenance program, a neck maintenance program. You get the idea. But this is not common knowledge until actually things start to go bad, and then you realize, oh man, I need to have treatment for my aching neck. When all along you could have prevented it. Okay, this is a very real issues that we're facing because we're so modernized now that our society actually discourages us from moving. All right. Sometimes I wonder how I would move if I lived in the Amazon. You'd have to squat, you'd reach up for the low-hanging fruit, climb a tree, get on your hands and knees. You would never sit. Of course, you would probably die from diseases. Anyway, you get the point. So that's the lesson for today. Perform your own manual, soft tissue manual mobilization regularly. If I'm at the movies with my wife, I start massaging. I'm looking for any kind of restriction there. I need these guys. This is my moneymaker. So the lesson here is maintenance program for your tissues. Make sure you have full range of motion in your joints. Make sure your joints line up correctly. And if you do that, you're going to move very, very efficiently in gravity. And gravity will have a very little impact on how you move and how you operate in gravity. So hopefully this is helpful for you guys. I mean, there's tons of literature out there. You can even go on YouTube and look at how you can mobilize tissue using lacrosse balls or foam rollers or Theracanes. But the point is, do something with your tissue so you don't have any issues with your tissues. Okay? See you guys later.